Hi, welcome to week 4 of the 40 weeks series to support the parents of toddlers who receive the cochlear implant below the age of 2 years, and this is to support them through the second year after their cochlear implant. If you want to download the full resource from our website, the link is given below. And if you want to go back and watch the other episodes which you have missed, link for them is also given below. Subscribe to Cochlear India YouTube channel and don't forget to press the bell icon on the right side so that you get notification of all the episodes. Let's start with today's goals, starting with the auditory goals. We still have 2-item auditory memory selection as our goal. Last time we were doing with 2 actions separately, verb and action. So noun, verb. So this time we are focusing on 1 noun and 2 verbs. Now, for example, if you tell the child, peel the orange and eat it. There are 2 verbs. You may say, peel the orange and throw the peel in the basket. So there's still 2 verbs and 1 noun. So like this, you give the commands and instructions throughout the day, where the child has to listen to 1 noun and 2 verbs and follow that command. So he will remember 2 items. Again, in receptive language goal, we are still continuing. Where is? The child has to understand where is she, where is he, where is it. So your child will start listening to where and will start associating it with vocabulary of prepositions. So when you say where is it, the answer always has to be on, under, behind, anything to do with the preposition. So we are increasing their vocabulary from noun to actions and now actions to prepositions. We are adding that vocabulary into their receptive language. For example, how you do that? For example, you remember we were talking about where is spot. You had this book with you, and this you did in the first week. Second week, we were talking about who is behind the door. So now we can use the same book and the same pictures, but we will be using where is. So we say, where is Spot? Is he there? No. Again we move on and we say, where is Spot? Is he behind the clock? No. Where is Spot? Is he in the piano? No. So you see how prepositions are coming? Whenever you say where he is. So where in the end you say that where is Spot? Where is Spot? He's in the, you say where is Spot? The child also, your child should say where is Spot. And then you say, see in the basket? Oh, Spot is in the basket. So prepositions are coming. You can also do this during daily routine activities. Suppose you ask, where is Papa? Where are your shoes? Where's your water bottle? Where are my glasses? So this way he can help you. He understands where and the prepositions. Coming to expressive vocabulary, we were doing up last week. Now the child should be using up. So suppose you have cookies in the jar and the jar is on the upper shelf in the kitchen. So you say, where is the cookie jar? He says up. Yes, it's up on the shelf. So you give extension of vocabulary, expansion of vocabulary to increase his value. The same way you do when you are saying present continuous tense, the child should be using present continuous tense now. Every time you say, what's he doing? So you ask the question, what's he doing? And now the child starts asking the question, what's he doing? So this will also become our expressive vocabulary goal. What's he doing? So the child again is giving present continuous tense and that is getting reinforced. Another goal in expressive vocabulary is that the child should be speaking in 4 to 6 word sentences now. So earlier he was speaking in 3 words or maybe 2 words, so that was fine, but not now. We have to increase that, no? So he should be speaking in longer sentences. How will you help him? Suppose you say, what is Papa doing? So he says, Papa is talking. So you say, Papa is talking on the phone. What's Papa doing? Now he has to say, Papa is talking on the phone. The same way you say, what is Didi doing? Didi is playing. Didi is playing with? So he's fill in the blanks. So you're asking questions, you're giving fill in the blanks, and he says, Didi is playing with the doll. So this is another expressive goal. Coming to speech goal, we are continuing with ng, n plus g, ng. It's a little difficult word, so it takes more time. So this week also we are continuing bombarding that, giving reinforcement on that, and auditory bombardment on that. I just remember there is a book which is called Mr. Strong. Maybe next time I'll find it and show you. So when you read that book, that story, no, Strong comes at least 30-40 times in the whole book, but meaningfully in different sentences. And then the child tries to say strong and ng comes like that. So therefore, you can do picture talk, you can do story, you can do daily routine. There are all these same activities you can use where you are using the word with ng. Also, there's another speech goal at this week, that's babbling. See, your child is still about 2 years of age, so therefore you can still do babbling. So this week we have a goal of 2-syllable babbling. That is consonant, 2-syllable consonant and vowel babbling. But we are going to alternate the vowels. Like suppose remember we play the babble game where we use a nonsense word. Papu, papu, koki, koki, tatu, tatu, tota, tota, like that. And the child imitates the same sound. It's a lovely game, fun when we play. And from there you say, dadi, dadi, nanu, nanu, mamu, mamu. So the words become meaningful. So this game can lead to some of the family members' names. Also, story. For this week, I recommend, what's that? Good Night? Good Night Moon. See, Good Night Moon is a story where you are, every time you will say, I'm going to sleep now. You talk to moon and you say, I'm going to sleep now. The moon is going, I'm sleeping. So I am sleeping, and the next structure you're saying, I'm going to sleep now. So that becomes future tense, not only the present continuous tense. So this way it can help you. Okay. Now tips. So what can we do? How can we teach all these goals to the children so that it becomes motivating and natural and normal? First, keep a diary. I'm sure you have a diary, but if you don't have, start a diary. In the diary, in the notebook, whatever diary, I mean notebook, to take some notes. Write down whenever the child says a new word. So write the new word he speaks and write the date on which he speaks the new word. You will certainly notice that the child is using new words which he was not using earlier. Of course, these words will come from his receptive vocabulary. Whatever he understands, that he started using now. Every week, the child should learn new words, should say new words. And then you can share it with your therapist, who will keep a track to see which week the child is not giving new words. Is the pace of learning new words quite expected or not, or what should be done? We have to increase the vocabulary of the child because he's far behind in language. So another thing you can note down in this diary is their milestones. See, again, your child is very young, maybe near about 2 years, a little more than 2 years. So they might be going through motor development stages also still, especially the finer motor development stages. So you might write one day that he's stringing the beads properly, or he's counting with the fingers till 3, or maybe he's dancing, his steps are more in rhythm. So whatever he's doing, or problem solving, or he's scribbling straight line or vertical lines, all these are the milestones in a child's life, which is even motor development stages, cognitive stages. So all that we have to capture and understand what the child is doing, so we can track the progress of the child. Okay. At this stage, we also now we have a new formula which is called 5 E's. Now, which are of those 5 E's? Let me check. Expose, expect, experience, expand, and express. I repeat that. Expose, expect, experience, expand, and express. So let's see what are these. What is expose? We expose the child to auditory experience. Now that your child is listening for more than 1 year, he should be listening well. It should become a part of his habit to listen all the time. So give him auditory experience. Stop using gestures to help him. Stop looking at him so that he gets some cues from your facial expressions. Just insist on auditory experience. Talk, make it simpler if he can't understand. Use intonation if he can't understand, but always do it through audition. So that is auditory experience you should give, which is exposure. Second is expect. Now expect the child to give verbal communication. So how do you expect verbal communication? After 1 year of therapy, he should be using some words. No, he's already 1 year hearing. So what you expect is that when you speak, the child imitates the last word, or the child substitute his own words, or he might use spontaneous language. When you ask a question, the answer should be in spontaneous language and not the imitation. So verbal communication in turn taking during spoken language interaction is what we are looking for as expectation. In experience, we have to give the experience of that particular new vocabulary to the child. We can give a lot of reinforcement through games, craft, book, story, daily routine, and see that how he can gain experience. Well, I can give you one example of abstract word hungry. How do I teach the child hungry, the concept and the word of hungry? If I tell him I'm hungry, will he understand? No. If you ask your child, are you hungry? Will he understand? No. If you tell him, I am hungry, will he understand? No. But even if you use gestures and you say, I'm hungry, will he understand? He will think you have stomachache and you are not hungry. He won't understand you're hungry. So what you should do is make him feel hungry. Let him have the experience of hungry. So how to do that? Suppose every day you're giving your child lunch at 1 o'clock. So tomorrow don't give him at 1 o'clock. Wait till 1:30. Don't give him lunch. He will be hungry, no? So he will open the fridge, he'll ask for chocolate, he'll make fuss, and then you say, oh, you're hungry? You want to have food? You seem to be hungry. Let's have food. When you serve him food, he's eating, then you can say, you are eating very fast. You must be very hungry. Then when you want to serve him more, you say, do you want some more food? Are you still hungry? When he finishes, then you say, do you want more? No? Finish? You're no more hungry? So what have you done? You have used the word hungry in so many different sentences, but still they are meaningful, relate to his feelings, relate to his experience, and he will understand that word better and faster. Next is expand. Expand the language. We can expand the language 2 ways, horizontally and vertically. Horizontally means When we talk about horizontally, then we say, for example, you're wearing a very pretty dress today. Oh, today your dress is prettier. Today is the prettiest dress you have worn so far. So you know those degrees you are giving, superlative and comparative degrees you are giving, more and most. And when you're doing vertical also, you're the same way you can do more and most. You more hungry, you're most hungry. Your dress is more pretty today. It's most pretty. Something like that. So these different synonyms and different degrees, when you use, you are expressing and expect the child to express these as soon as he learns it. As they go into the receptive vocabulary folder in their auditory brain, it is stored there in their working memory, and the children start using it and expect them to express it, motivate them, reinforce it, and encourage them. Okay? Hope that will all help you. Try it out, please. Let me know. Send some feedback or questions on the comments. Then I will answer your questions. I'll help you. Thank you. Hope to see you next week.